Hello everyone, this is Dr. Rahul Mathur, MBBS MD Psychiatry. I am a neuropsychiatrist, de-addiction specialist and a sexologist. So if you have to understand about the types of sexual dysfunction, first probably we'll have to understand about this sexual cycle. And एक sexual cycle होती है in males if we are talking about. So let's say if a male has a sexual thought, so he has to have a sexual desire. मतलब sex करने की इच्छा होनी पड़ेगी. So the technical term for it is desire. Once a male has desire, then he has erection. Following the erection is ejaculation and orgasm, and then comes the resolution phase, है ना. तो एक ऐसा एक पूरी cycle होती है, and resolution के बाद again you come to the desire वाला phase. So cycle में इसलिए समझा रहा हूँ कि based on the cycle the types are differentiated. So the two main types of sexual dysfunction which we commonly encounter in our practice, first is erectile dysfunction. तो erection में ही problem हो जाती है. So typically we see males coming to us who say कि sir we have desire, मतलब हमें sex करने की इच्छा तो होती है but the erection is not there, है ना, and because of that they are not able to have sexual intercourse. A typical situation is they would say that sir we have got married recently, we have gotten married, earlier they used ऐसी problem पहले नहीं हुआ करती थी, and but अब होने लगी है, and whenever I go to my wife we intend to have physical relationship, but during the time of intercourse I just lose my erection. If you ask them, there are many times they would report ki the morning erections are there. On usual occasions they would have erections, but during the time of intercourse they don't have it. So this is a typical example of what erectile dysfunction is. It can be of multiple types. अलग-अलग situations में हो सकता है. कई बार because of different reasons ही हो सकता है, because of addiction हो सकता है, because of tobacco हो सकता है, alcohol हो सकता है, diabetes की वजह से हो सकता है. But the main problem, the pathology is the lack of erection. The second common that we frequently encounter is premature ejaculation. So typically, we receive the males, they come to us and they say, "Sir, I have desire, मेरी इच्छा होती है. I also have erection, but at the time of intercourse, the time is very less." So the layman term of explaining it is, sir, I get discharged very easily, है ना, मेरा जल्दी discharge हो जाता है sir, and the typical time for it is less than 1 minute. So if a person is having an intercourse of 2 minutes or 3 minutes duration, that is considered to be a normal period. But if a person is having orgasm or having ejaculation within 1 minute, that is typically categorized under premature ejaculation, or short form for it is PME. So another frequent issue that we encounter in our practice is Dhat syndrome. So males, they come to us and young males typically they come to us and they say कि sir धात जा रही है ना, and they say कि sir mornings में जाती है, या फिर at the time of sleeping they would say that so discharge हो जाता है, और the typical term which is used in our area is known as dhat, है ना. So I would briefly want to talk about it. It is called as Dhat syndrome. It is a belief that men who have loss of semen, मतलब अगर किसी को discharge हो रहा है without any reason, या फिर during the time of defecation, यानी कि potty जाने के टाइम पे अगर discharge हो रहा है, तो it leads to loss of energy or loss of vital nutrients, because semen is considered to be sacred. That is their belief, but it is more or less a psychological thing. If we have to explain, like semen, we have a lot of fluids in our body, and as a sweat is our fluid. If we talk about saliva is another fluid. हम जब थूकते हैं तब हम ये नहीं सोचते कि हमें कमजोरी आ रही है. Semen is again a fluid in our body which gets regenerated or rejuvenated whenever it is lost. So the belief that the loss of semen leads to lack of energy is kind of psychological, and even then the patients, they come to us, the males, they come to us और बोलते हैं सर हमें कमजोरी तो फिर भी रह रही है. So I just want to address it that the treatment is available. We have some medications for it which can decrease these weakness, and it can really cure the Dhat syndrome problem. So about the treatment of sexual dysfunction, sexual dysfunction का treatment, there is a process for it. सबसे पहले वी हैव टू अंडरस्टैंड व्हाट द प्रॉब्लम इज. सबसे पहले हमें कारण को समझना पड़ेगा. तो ट्रीटमेंट का फर्स्ट स्टेप इज टू अंडरस्टैंडिंग द प्रॉब्लम, वेदर इट इज़ फिजिकल, वेदर इट इज़ साइकोलॉजिकल. वी रन थ्रू सम टेस्ट्स एंड उसके हिसाब से देन वी डिटरमाइन हाउ द सोल्यूशन ऑफ दिस प्रॉब्लम कैन हैपन. अगर हम ट्रीटमेंट ऑप्शंस की बात करें तो देर आर मल्टीपल ट्रीटमेंट ऑप्शंस विच आर अवेलेबल दीज डेज. A frequent medicine which is taken for the treatment is Viagra. There are times where people come to us कि सर Viagra तो हमने लेके देख लिया पर उसका असर कुछ नहीं हुआ है. So Viagra is not the only drug which is available. As I have told, सबसे पहले we have to understand the problem, and based on the problem, there are different treatment options. Among the treatment options, there are medications. There are allopathic treatment for it. There are alternate systems available for it. So आजकल in the days we understand that even Ayurveda has a role in sexual dysfunction, but there has to be a technical reason to approach this problem. आजकल हम लोग allopathic treatment के साथ में there are some treatment options जिसमें कि आयुर्वेदिक दवाएं भी mixed हैं. So the treatment is mixed, which is allopathic as well as Ayurvedic. And there are other treatment options as well. आजकल कुछ therapies होती हैं, psychological therapies होती हैं. So in today's world, आजकल बहुत हमारा जो working environment है, it has become very much stressful. And because of the advent of mobile phones and internet, our lives have become, very, very much stressful. So there are times where stress is the reason of only stress. Like all the investigations are normal, but only stress is the problem or cause of this problem. In that case, there are psychological interventions or therapies which are available. We do it and it is very, very effective. कई बार एक short session से या week के session से the problem gets solved. हम सबसे पहले यही समझते हैं या समझाते हैं लोगों को कि यार किसी भी प्रॉब्लम को अगर सुलझाना है तो the first step is to understand what the problem is. And then we go through a proper stepwise procedure and then give the treatment to the patients. So as we talked about the psychological reasons, आज के ज़माने में we live in a world which has become very stressful, and there are many times where stress is the reason of all these causes. And there are other issues as well. ऐसे कई बार a person is going through depression or anxiety or any other mind related problem. In that case, if the person is experiencing sexual dysfunction, उस केस में probably psychological therapies are very, very useful. Mindfulness is a different technique altogether. Mindfulness has been an age-old technique in China, and recently our psychological therapies have adapted that concept, and it focuses to be in the moment. And it works in every case of sexual dysfunction. So yes, the question is yes, the psychological therapies, the cognitive behavioral therapies, the mindfulness, all these therapies are very useful in treating sexual dysfunction. It has role in different problems differently, so we have to understand when and where these are applicable. But in short, these are very useful techniques and methods which are used in sexual dysfunction. So very frequently we come across with young males who are experiencing, in their 20s or 30s, and they are experiencing sexual dysfunction problems. अब कई बार वो आके पूछते हैं सर इतनी यंग एज में हमें क्यों हुआ? Why did it happen to us at such a young age? So I would say that the lifestyle choices that a person makes has a very big impact on their sexual life. In short, addictions and a stressful life, they release toxins in your body, and these toxins in a way they affect your genital organs, they affect your hormones, and they affect your sexual life. So sexual or the lifestyle changes are a very important have a very important role in managing erectile dysfunction, especially in young males. And anyways, we are experiencing or we are seeing patients who go through a stressful lifestyle, and they're waking up late, they are going to their bed late in the night. So this leads to generation of lots of toxins in their body. So yes, lifestyle changes has a very big role. It can do wonders, and it can impart a lot of change in a person's sexual life. So it is an important thing which it should be addressed. अगर मैं एक मैसेज देना चाहूँगा, इफ़ आई हैव टू गिव वन मैसेज टू मेल्स, आई वुड टेल देम कि टेक अ टेक्निकल एडवाइस, है ना. अपने दोस्तों से आप डिस्कस कर रहे हैं, आपके रिलेटिव से आप डिस्कस कर रहे हैं, it's a good thing, to talk about a problem is a good thing, but you might not receive the right advice from them. So take a good technical advice from a proper person who deals with these problems. And another message that I would like to give the men is that ये problem है, it is a problem which has a solution, but many men see it as a weakness. So they say, एक common saying है कि the sexual problem or the sexual life is directly linked to a male's ego. So you do not have to take it to your ego. If there is a problem, there is a solution for it. There are many problems which are very small, and it is very easily solvable also. So one advice is take a proper and technical advice before you reach to a conclusion, and if you do anything to your body, take a proper technical advice first.